We started on this past Saturday afternoon, and we've covered a plethora of topics. So if you've missed any, the replays are available. Of course, they're on YouTube as well, I believe. So before we get started, let's ask the Lord's blessing, if that's okay. Dear Father, thank you so much for this opportunity to gain more insight so that we might be able to be the best version of ourselves. And so as we go through this, we pray that we might understand those things that might apply to us, but also help us to see how we might better serve others. In your name we pray, amen. Okay, so today we're going to deal with probably two of the more common mental health issues, which is anxiety and depression today. We'll talk about and kind of look at some different disorders a little bit. We'll talk about coping, and then of course we always have some resources in there. So mental health here is defined as our emotional, psychological, and social well-being. So mental health is a really broad topic, and I think I mentioned to you that it used to be, when you think about the term mental health, that you only thought about extreme cases and situations, but now we know that that's not the case at all. Stress is a mental health issue. So if you're dealing with stress, specifically acute or chronic stress, then that can certainly do just as much damage as any of the other mental disorders. But our emotional, psychological, and social well-being. And the reason why this is important, because what this tells us is that mental health matters for all of us, and it's all of our responsibility to make sure that we're taking care of ourselves in these different areas. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. And so this is something that has to be maintained. It's not something that we can sort of address at one season of our life and then not do the work to maintain it, but it has to be ongoing. The Public Health Agency of Canada, this is pretty interesting. They define mental wellness as the capacity of each and all of us to feel, think, and act in ways that enhance our ability to enjoy life and deal with the challenges we face. It is a positive sense of emotional, spiritual well-being that respects the importance of culture, equity, social justice, interconnections, and personal dignity. That's a lot, isn't it? That's pretty broad there. And so what we're seeing here, and I believe this to be the case, and I really like this this definition here of mental wellness, because it impacts every capacity of our life, every capacity of our life. Mental illness from the APA defines mental illness as health conditions involving changes in thinking, emotion, or behavior, or a combination of these. Mental illness are associated with distress or problems functioning in social, work, or family activities. And I know that there's some students here, and if you ever take a course dealing with diagnosis, which I'm sure you probably will, you'll look into the DSM-5. For many of the mental illnesses that are listed there, these two aspects are really key. Does it cause the individual distress? And does it impair the individual's functioning at home or work or in their social life, right? Those are two key points there. They include, and of course this is not an exhaustive list, but you see some of the disorders that are mentioned there. The good thing about the DSM-5 is the Diagnostic Statistical Manual. What it has done for something like depression is that it has, as well as addiction, is that it's now on the spectrum of mild, moderate, severe, right? And so I think that's because there's a recognition that everybody is different. Everybody's not dealing with necessarily the same level. They may have the diagnosis in that they meet the criteria, but they may not necessarily be on the severe end of the spectrum. They may be more on the mild end of the spectrum. So be aware of that as well. All right, depression ranges from serious to mild, as we just talked about that. Clinical depression is the more severe form of depression, also known as major depressive disorders. Not the same as depression caused by a loss such as the death of a loved one. Generally speaking, the clinical depression, individual will meet the criteria, and we'll go over that criteria in just a moment. An individual will meet that criteria with no recent emotional distress. In other words, there's nothing that they can point to as to the reason why. In other words, they will experience these symptoms seemingly just out of the blue for no apparent reason. Job is good, family is good, but for some reason they are experiencing these symptoms. And so that usually gives you some kind of clue of whether or not a person may meet the criteria for clinical depression. Of course, there are screening tools. One of the screening tools that I use, and there are several. There's, of course, Beck's Depression Inventory. The PHQ-9 is also a pretty good screener. The purpose of the screeners is not to diagnose, but just to let you know should we go further in looking at the criteria to see if this person may meet the criteria here. 5 or more of the following symptoms have been present during the same 2-week period and represent a change from previous functioning. At least one of the symptoms is either, this is for clinical depression, one of the symptoms is either depressed mood, deep sadness, emptiness, or loss of interest or pleasure in activities that a person used to enjoy, right? And so here are those signs. They're feeling of deep sadness, emptiness, or hopelessness, angry outbursts, irritability or frustration, even over small matters, and restlessness. A loss of interest or pleasure in most or all normal activities, sleep disturbance, including insomnia or sleeping too much, tiredness or lack of energy. You'll see this in the DSM, and it'll say fatigue there. Reduced appetite, weight loss, or increased cravings for food and weight gain. So for both sleep and appetite, you can go either way. Slow speaking, slow body movements, feelings of worthlessness or excessive guilt, fixation on past failures or self-blame, trouble thinking or concentrating and making decisions. And then the last one, of course, is frequent or recurrent thoughts of death, suicidal thoughts, attempts, and that sort of thing. And so this is what, whether you see a mental health counselor, whether you see a psychologist or a psychiatrist, these are the symptoms that they're looking at here. All right, so of course, you'll see this several times throughout this presentation just so that people know we're certainly not here to try and diagnose. This is about education here, but there is help available. Usually the best is considered a combination of medication and counseling. Making a doctor's appointment, actually your primary care doctor can really diagnose whether you're suffering from depression or not, and many do. EAP professionals, this is a great resource because it's free. And this is where your company or whoever that you work for will have an employee assistance program. That employee assistance program usually provides a certain amount of free counseling sessions. Usually EAP professionals don't diagnose, but they are trained professionals. Many of them are mental health professionals and social workers in that regard. Practical steps here, and we'll get more into this as we go on, but this is more of long lifestyle changes. Of course, connection is very key in this regard, so finding an ally, having a good self-care plan and sticking to that self-care plan, regular hours of sleep, and we'll talk a little bit more about what happens with the sleep, why the sleep is really important. The research is showing that individuals who don't get enough sleep or either sleep too much, that either one of those are, as we saw, characteristics of depression. Exercise, we'll talk about even beyond endorphins, what exercise does, changes in diet, and then of course dealing with and managing the stress in your life. What about anxiety? Well, the APA defines anxiety as an emotion characterized by feelings of tension, worry, thoughts, and physical changes like increased blood pressure. And so one of the things that happens when I'm working with clients who have anxiety, we also discuss not just the feelings of anxiety, but the worry that's the undercurrent of the anxiety, right? And so oftentimes there's an incessant worrying going on. Anxiety is a normal response to the perception of a threat. Normal anxiety is not a disorder or a mental illness. So we can have a level of anxiety that is not necessarily clinical in that regard. Stress as well. That stress it also falls into that category. That's good stress. They actually call that eustress. Normal anxiety is a biological way to prepare us to face a difficult situation. When does it become a problem? Well, the duration of severity of anxious feelings can sometimes be out of proportion to the original trigger or stressor. In other words, you know, the stressor, the level of anxiety that I'm having does not meet. It's not consistent with the level of stress that I'm dealing with. So the severity is sort of out of proportion from what I'm actually facing. Physical symptoms persist. Increased blood pressure, nausea may also develop. These responses move beyond anxiety into anxiety disorder, right? The APA describes a person with anxiety disorder as having recurring intrusive thoughts or concerns. And so intrusive is really the key word there. Intrusive just means that, you know, even I'm trying not to, but it's coming anyway. I'm having these thoughts anyway, even when I don't want them. Once anxiety reaches the stage of a disorder, it can certainly interfere with daily function. And we'll look at some different types of anxiety as well. There are different types of anxiety. Obsessive compulsive disorder is a type of anxiety. I don't think I have that one on the slide here, but that's also a type of anxiety. There's generalized anxiety. And so generalized anxiety usually in the DSM-5 just means that I'm not anxious about anything in particular. There are a number of things. It's across the board that I've experienced these feelings here, this restlessness, this being on edge, uncontrollable feelings of worry, increased irritability, concentration problems, and of course, sleeping problems. While these symptoms may be normal to experience in daily life, people with generalized anxiety disorder will experience them to persistent or extreme levels. And so this may present as a vague, unsettling worry or more severe anxiety that disrupts day-to-day living. And so does it cause distress? Does it interrupt my daily functioning? Those questions there are really pertinent to being able to diagnose the generalized anxiety disorder. And again, it's not anything specific. It's a number of things that I'm having this reaction that will qualify here. Now, panic disorder, brief or sudden attacks of intense terror and apprehension characterize panic disorder. I don't know if you've ever had a panic disorder, if you ever talked to someone that have a panic disorder, but I think probably across the board, people will tell you that there are very physical symptoms, breathing, and maybe feeling like, you know, you're about to die, so to speak. These attacks can lead to shaking, confusion, dizziness, nausea, and there's the breathing there. Panic attacks tend to occur and escalate rapidly, peaking after 10 minutes. However, a panic attack might last for hours. So this is pretty disruptive to a person's life to experience this here. Specific phobia. So we go from generalized anxiety to dealing with panic to now phobia, an irrational fear and avoidance of a particular object or situation. Phobias are not like other anxiety disorders as they relate to a specific cause. A person with a phobia might acknowledge a fear as illogical or extreme, but remain unable to control feelings around it. So an example might be, I think originally when they were studying this many, many years ago, they did an experiment with a child, actually. They don't do that anymore today. But I think it was something that was white and furry, right? Just something that was white and furry. And what they found was anything that resembled white and furry induced this sort of panic here. And so this is something very specific in that regard. That's the only reason that I tell you that. There are therapies that are designed to treat this. So a lot of people, well, I'm not going to go into the therapies, but since I said I will mention one is exposure therapy. And, obviously you have to be a trained mental health professional to do that. But exposure therapy is, let's say that my panic is in relation to bridges, right? Because maybe there was a terrible accident and it happened on a bridge, right? And but the place where I live, everywhere I go, I have to cross a bridge. And so what do I end up doing? Not going anywhere, because I can't go over that bridge. So exposure therapy creates a hierarchy of exposure, right? It may start with something as simple as, okay, let's draw a picture of a bridge, right? Or let's watch someone driving over a bridge, right? And you process through those feelings and so forth and so on. Through that experience, usually counselors will tell you, hey, you can tap out at any time. That is too much. But you can see that the idea is to start small and then let's gradually build up to where maybe we're standing, at the bridge. We're looking at the literal physical bridge, and then slowly but surely we work our way to driving over the bridge. So agoraphobia, this is a fear and avoidance of places, events, or situations from which it may be difficult to escape, or in which help would not be available if a person becomes trapped. People often misunderstand this condition as a phobia of open spaces and the outdoors, but it is not so simple. A person with agoraphobia may have a fear of leaving home or using elevators and public transportation. And so people are usually, I don't know that people have the right label for it, but usually, most people have at least heard of someone who won't leave home, right? And this is what you have here. All right, and of course we can go on and on, but I'm not. Social anxiety, of course, fear of the negative judgment from others in social situations or of public embarrassment. Social anxiety disorder includes a range of feelings such as stage fright, fear of intimacy, and anxiety around humiliation and rejection. This disorder can cause people to avoid public situations in human contact. So what you'll find is individuals with social anxiety disorder, oftentimes, if they work, they'll work like the night shift, where there's very few people around, there's hardly anyone around, right? They're comfortable in those situations. But the minute a collection of people start to come, then this begins to cause distress and dysfunction in their lives. There are a ton of helpful strategies and techniques, all designed, of course, to work with a clinician and working through this. We have some guided relaxation, some prayer and meditation, some exercises. Oftentimes that anxiety produces a lot of adrenaline and cortisol in the body and that sort of thing, and then replacing negative thoughts with positive ones. And we'll talk a little bit more about that. Not everybody is the same. So for some people, medication may also be necessary while an individual sort of becomes stable enough to be able to incorporate some of the skills, right? And so individualized care is really important there. So there it is, we just talked about that. Unlike with depression, this is very important too, unlike with depression, medications used for anxiety have the potential of significant physical addiction. So really have to be careful about that, especially if you're already prone to addiction. Oftentimes the things that are used, the medications that are used to treat anxiety are like your benzodiazepines, Xanax, Klonopin, those types of things. They're really strong, really strong. Matter of fact, in addiction counseling, we call it alcohol in a pill. Really, it has a sedating effect, but you have to be medically, you have to go through withdrawal management in order to get off. And there are some people that just been on for years and years and years. And again, everybody's different, so we don't want to compare anybody's situation, but this is a risk. And so people should know when you go the route of medication. Now, there may be some medications that are out there that are not as potent as the benzodiazepines. There may be options. Those may be less effective depending on the level of severity there. All right. So I'm sorry, it says protect yourself from anxiety and depression. I meant to change that. I really shouldn't say protect yourself as if, it's an enemy or something like that. Anyway, coping is what I wanted to really say there. So maintaining physical health, so exercise. And so I'll tell you this, there was a study at Duke University where they took individuals, two groups of individuals with major depressive disorder. The one group, they gave traditional antidepressants. The other group, they put them on a moderate aerobic exercise program. That exercise program was them walking, right? They walked about 30 to 45 minutes a day. Now, the result of the study was that individuals who received the medication, they obviously experienced relief faster. But the individuals who were subjected to just walking, and that's it, they experienced the same relief as the individuals who took medication after about 16 weeks. So from that research, the conclusion was that aerobic exercise program, physical exercise can be just as effective as antidepressants. Now that was that particular study. And so really is important to include this type of exercise. Obviously, eating nutritious meals, limiting sugar. I think we talk a little bit more about this too, and I guess I'll just touch it now. So what the research shows that Dr. Neil Netley, Depression, Anxiety Recovery, has a wonderful lifestyle program. He talks about this, and he has the research that individuals who suffer from depression have a 40% clinical depression, that is a 40% decrease in blood flow and activity in the frontal lobe, right? So we're very much looking at a brain disease, a brain disorder when we talk about depression there. Well, eating a diet that's full of complex carbohydrates actually increases serotonin production in the brain. And of course, you know that serotonin is important because it supplies the chemical, it's a chemical that helps to stabilize mood, right? Now, the interesting thing about this particular research was that individuals who had a low complex carbohydrate diet had low production of serotonin in their brain. So this was kind of like really good research that showed about the benefits of eating the right foods. So I worked in a psychiatric hospital for 14 years at the very beginning of my career. And unfortunately, you see a lot of things. I mean, I come from the days where they didn't necessarily use straitjackets, but it was a padded room, and we did from time to time. We had to, for individuals' own safety, you have to strap them down and that sort of thing. Anyway, I'm done with that. That was 14 years. So, but I thought to myself, knowing this information, learning this information, wow, I wonder how much of that could be avoided if the hospital invests in a nutrition program, right? Because the research is out there that says that nutrition intervention, right? Some people call it nutrition therapy, is effective for psychiatric disorders, right? I had that slide in here, but I took that slide out. But it's there in the literature. So I couldn't help but think about that. Eliminating negative behaviors like negative thinking. I want to share with you a little bit more about that. Overuse of substances, not taking care of yourself. These are some negative behaviors. Alcohol, we've talked a lot about alcohol. Well, alcohol is a depressant. So it's not going to help matters. One of the criteria for diagnosing substance use disorder in the DSM-5 is that the individual uses the substance, but they have a psychiatric disorder that is either caused by or exacerbated by use of the substance, right? So if you're drinking and you have, anxiety, you have depression, then certainly you could be doing more damage. And establishing ongoing medical care is really important to have a team around you. If this is something that you're dealing with, that team should include, mental health clinician, psychiatrist, primary care doctor, all of these individuals to sort of help you with this. These are some more practical steps. Developing and joining a support group and a community, addressing spiritual focus, and of course, getting help with the family. Now we've been talking about family. I read a research recently in my doctoral course that it was a case study that it was an African-American young lady who was suffering from depression. Went to the counselor, but there was some resistance there. The basis of this study was to see would family involvement make a difference. I think around the 7th session, if I remember correctly, the young lady's father was invited to the session. Finally, the therapist realized what the issue was that the dad had a negative view about, the dad didn't believe in mental health issues, didn't believe in depression. Just pull yourself up by the bootstraps, you don't whine, you just keep going, which is why, and that still exists, by the way. Anyway, the therapist provided some much needed education. By the end of the session, the dad was on board. The dad went back home, got everybody else on board. And the interesting thing about this session, I talked to you about the PHQ-9, the GAT-7. Well, part of the research was that after every session, the client would take these screeners, right? So up until the 7th session, the numbers were really high, which means that there just wasn't much progress at all. After the 7th session, all the way up until, I think, a 6-month follow-up, okay? After the last session, it was 6 months follow-up, the numbers began to drastically improve. Why? Because the family was freed from the stigma about mental health. Now the entire family was supportive, and it made all the difference in the world for this particular client, right? So family support is really important when it comes to this sort of thing and creating a supportive environment. We talked about maintaining spiritual health, connecting with a meaningful spiritual path, finding and connecting with the community of faith is really important as well. Now, in the literature, in the psychiatric research, in the journals, there are risk factors that are mentioned for these illnesses. And I've listed a few of those risk factors. Of course, family history and genetics. Since we have been talking about addiction, I'll just mention that the research shows that there's a 60% chance, 60% of the influence of an individual becoming or developing a substance use disorder is genetic. Here's what that means. If you take an individual who has never drank, okay, we'll just use alcohol, they've never drank, and they start drinking, versus an individual who has also never drank, but they have a family history, this person is 60% more likely to develop alcoholism than this person. That's not to say that this person won't, but the genetics say that this person is 60% more likely. So that's what that means. So that's pretty strong, right? In fact, I'll tell you this. I worked with Dr. Christopher Adelman. I believe Dr. Adelman is retired now, and Dr. Ted Perrin in Ohio. He's one of the leading addictionologists. He teaches at Case Western Medical School. And their research showed that there is a stronger link, a genetic link between addiction than any other illness. Stronger than the genetic link in cancer, stronger than the genetic link in high blood pressure, stronger than the genetic link in any other illness. The strongest is addiction by far. And so that research was pretty fascinating. Well, anyway, when it comes to depression, this also is a factor, family history and genetics, right? There are certain medications and medical conditions that can also create high risk for an individual. Social and environmental factors, nutrition and lifestyle factors, right? Not getting a diet rich in complex carbohydrates, not exercising, no regular sunlight. I know in Ohio, and I suppose to some degree may be the same in Michigan, but there's a lot of time where we don't have sunlight. Nobody's going sunbathing at this time. Well, that impacts individuals, right? Usually vitamin D levels are low and that sort of thing, and that can cause some real problems. So that's something that you want to check on. Thinking patterns, addictions, and there may be spiritual needs that are also need to be addressed. So we've talked about the importance of talking to your healthcare provider, having a conversation with your healthcare provider, get those vitamin D levels checked. If you're not feeling right consistently, don't just dismiss it as you're just going through a rough patch, right? Have the conversation. Have the conversation. Just as Dr. John Reddy who is a neuroscientist, he says depression is an erosion of connections in your life as well as between your brain cells. So again, we are talking about some dysfunction in the brain. Now I want to talk more about nutrition here because this is a category of importance. The research shows that particularly the research shows that individuals who they have a poor diet, that once they actually make the corrections in their diet, that they actually experience the largest gains. In other words, they experience the benefit of this faster than making any other change, okay? And I think it was about 3 or 4 weeks or something of that nature. But what tends to happen for individuals who are suffering from clinical depression, that there's low dietary tryptophan, okay? There's low omega-3 fat intake. Now, why is omega-3 is important? Well, because I talked to you about Case Western Reserve University, Dr. Joseph Calabrese and his cohorts at Case Western Reserve University did a study on omega-3. Now, and this study was a study in which they took individuals who were diagnosed with bipolar disorder. And what they did was they gave one group a placebo pill, the other group, they gave them a steady supplement of omega-3, okay? And what they found was that for the individuals who received a placebo, that there was virtually no change in their symptoms. But the individuals who actually received the omega-3, those individuals, they got better and they stayed in remission longer. You know, oftentimes bipolar is defined by this sort of cycling here, right, between mania and depression. But so this was a landmark study because now we understand the importance of omega-3 in the brain. Low folic acid intake, low vitamin B intake, a diet high in cholesterol, fat, and sugar, as well as individuals with marked anorexia or weight loss. These were nutritional deficiencies for the individuals who suffered from depression. So the best sources of tryptophan, because tryptophan is really important, and you want to get the right type of tryptophan, the type of tryptophan that crosses the blood-brain barrier. You know, most people know tryptophan by turkey. The problem is that even though you get sleepy, that's probably because we overeat. But tryptophan in turkey does not pass the blood-brain barrier. In other words, your brain doesn't use it. It does not convert from the blood to the brain. And so that's the tryptophan that really begins to make a difference, the tryptophan that actually converts into the brain, right? And these are the best sources of that tryptophan that's going to help to convert into the brain. Now, tryptophan, of course, turns into serotonin, which also turns into melatonin, right? So you're getting a triple benefit there when you're getting adequate dietary tryptophan. Tofu, sesame seeds, flax seeds and chia seeds, almonds, roasted pumpkin seeds, gluten flour, a lot of gluten allergies, and of course black walnuts. These are your highest sources. There are other sources, but those other sources, again, the blood-brain barrier is going to come into play there, okay? Omega-3 sources, we talked about flax seeds here, but you know, there's the flaxseed oil as well, English walnuts, ground flax, canola, black walnuts. Here are some non-plant-based sources here, Atlantic mackerel and halibut, pink salmon are some other sources, high sources of omega-3. So, all right. And then folic acid, chickpeas are probably going to be your largest dietary source. Black-eyed peas, lentils, red kidney beans, as you see it, it kind of goes down, but you're going to get the largest amount from chickpeas. Those are garbanzo beans. I don't know, sometimes I find that people don't either recognize them as garbanzo beans or chickpeas, but not both, which is interesting. Hummus. Hummus. There you go. Hummus. That's it. That's it. All right. Okay. So I'll go here and I've talked about the exercise, so we're going to skip through that because I talked to you about the study here. Oh, here's the, is this a study here? Yeah, this is from Professional Psychology, Research and Practice. So this is one of the articles that confirms here that exercise helps alleviate anxiety, substance use disorders, ADHD. So increases serotonin levels in the brain, as good as medicine for reducing depression. Okay, so just so you know that it is legitimate among psychiatrists and doctors in that regard. This here is one that I have sort of facilitated and helped people to incorporate this into their experience, and the reports that I've gotten firsthand was that it made a difference. And this is music psychotherapy. Now they do have, and I am really, because I'm not really musically inclined, but I'm really jealous for therapists and clinicians who can incorporate this into their practice. I'm just not able to, aside from streaming something, you know, but I can't actually play. Actually, when I worked in a psychiatric hospital, we had an activity therapy department, and we had a lady, Mary Ann, she's such a sweetheart. I think she's retired by now, but anyway, she would come around and she would play her guitar and she would have them sing, and she would incorporate this into their health. Anyway, this guided imagery and music, specifically classical music. We know that classical music sort of helps brain development and that sort of thing, but the combining of both, in other words, listening to traditional classical music while identifying and thinking about areas of your life that you want to improve, right? So this was this particular study. This is what they did. 12-week period. The ages in this study was ages 23 to 45. They had improved scores on tests of overall mood. All right. Reported feeling less fatigued and less depressed. On blood tests, it was shown that cortisol levels fell significantly. So this is not a fluke, right? When you're looking at the blood, you're measuring these hormones, you know, in the body, and you're seeing the results. Research consisted of pre-test as well. So all of these things were measured before and as well as after. Control group of 14 volunteers who did not participate in the classical therapy group there. This group showed no changes. Okay, so the group who incorporate the music versus the group that did not. Okay, so those results are really clear. So what I've encouraged clients to do and patients of mine is, hey, when you're driving, just put on some traditional classical music. I don't think I have that up here. Yeah, what they did was they listened to 45 minutes of classical music within a 2-week period. So it's not like you have to listen to classical music all day, every day. You know, just put it on 10 minutes here, 10 minutes there, you know, just in a 2-week period, you know, while you're consciously thinking about areas of your life that you'd like to improve. So this is the best kept secret. I've had patients come back to me and say, this was really helpful. This really worked, right? And they never listened to classical music and didn't want to do it either, but they did it, and they had some really good results there. All right, so this is a part, we've got about 15 minutes left here, but this is the part here that I think that we can all probably really benefit from, right? The negative thinking patterns that people tend to fall into. And I know you can't see that very much, but 12 common cognitive distortions. There are more than 12, but this is just to mention a few, just to get you thinking. You can look some of this up as well. It's not a secret. Some people suffer from all or nothing thinking, also known as polarized thinking or black and white thinking. Thinking in extremes, you're either a success or a failure. Catastrophizing, that's when you take small things and blow it out of proportion, right? Shoulds or must, right? And shoulds or must is when you impose rigid rules on how you or others should behave, right? So we don't just always say the shoulds are in 3 areas. We usually, some people call it the shouldy approach to life, right? We should on ourselves. We have these grand expectations that we place on ourselves. We should on others. he should, she should, they should, right? And when we do that, what we're saying is that there's no room for anything besides what I think should happen, right? And then some of us go to the next level. We should on the entire world, right? We have a thought process and expect people should learn how to drive, right? People should, right? Well, that type of thought process, really just leads to more frustration, because what you're thinking and your attitude, what people should do, they're not. And every time you see someone falling short of that, your frustration level rises, right? And some people have that approach to life. Overgeneralization, when a person applies something from one event to all events, right? So you have a bad relationship and, you break up with your boyfriend breaks up with you. Now all men are no good. Well, really? You see how we paint the picture with the broad brush in that regards? So that's overgeneralization. Personalizing, mental filtering, these are more, I'm not going to read them all to you, but I just want you to know that this is something we have to really be careful about. We have to really challenge ourselves. Jumping to conclusions when you decide on something without having all the facts, right? Mind reading, when you assume you know what others are thinking or feeling. Fortune telling, when you predict that events will unfold a certain way, right? And then the last one is identify with emotions, or I like to call that emotional reasoning, right? Things are the way you feel. That's emotional reasoning. What do we know about our feelings? That our feelings are not necessarily the best version of reality. Feelings can change, right? They can be quite flat. So these are thinking patterns that also need to be addressed that oftentimes underlie depression. They underlie anxiety, right? And if we don't have a process where we're regularly challenging our thought patterns, then we can get stuck, right? We can get stuck in viewing life this way. Now, one of the great therapies that really helps with this is cognitive behavioral therapy. Again, working with a licensed therapist, it aims at identifying and correcting erroneous interpretations of events and negative automatic thoughts that initiate or perpetuate a depressed mood. Did you get that? Negative automatic thoughts, right? When those negative thoughts are just automatic, you don't even have to try, right? To straighten out your emotions, first straighten out your beliefs and your self-talk, okay? Your beliefs and your self-talk is what you say to yourself. It's the conversation that you have with you, right? All right, we're almost done here. 11 irrational beliefs and self-talk statements. And I want you to think about, do you say any of these to yourself, okay? It's a dire necessity for me to be loved or approved by almost all others who are significant to me. Think about that as a self-talk statement of what we tell ourselves. And think about how these statements lead to certain consequences. The consequence here is low self-acceptance, low self-esteem, anxiety, and depression. When I believe that I must be, that it's a dire necessity for me to be loved and approved by all people. Now, when you don't accept me, when you don't like me, I've got some real problems now, right? Number 2, I must be thoroughly competent, adequate, and achieving in all important respects in order to be worthwhile. So here we combine our performance with our worth. The consequence, again, is anxiety, depression, inadequacy, and procrastination, low self-acceptance, and low self-esteem. Number 3, the world must be fair. People must act fairly and considerately, and if they don't, they are bad, wicked, villainous, or incredibly stupid. They should, that's a should, they should be severely blamed and punished. The world must be fair. So then when it's not fair, right, when I'm faced with the reality of unfairness, what happens? The consequences here, anger, rage, and seeking revenge. Number 4, the world must be easy. It's awful and terrible when things are not the way I very much want them to be. The consequences of that, depression, anxiety, and anger. Unable to tolerate when things are not easy or they do not go the way that you want them to be. Number 5, there isn't much I can do about my anxiety, anger, depression, or unhappiness because my feelings are caused by what happens to me, right? The consequences are unhappiness, emotional turmoil, fear, panic resulting from one's emotions and behavior seemingly being out of control. It's interesting because the CBT approach says that yes, sometimes your feelings are caused by what happens to you, but most of the time it's caused by what you think about what has happened to you, right? Okay, so this is just gives you some idea here. I won't go all of them, but I'll do a few more. So it's number 7, it's easier to avoid and to put off facing life's difficulties and responsibilities than to face them. The consequence is procrastination, guilt, major goals become jeopardized, self-defeating behavior, right? Number 9, my past history mainly causes my present feelings and behavior. Things from my past which once strongly influenced me will always influence me. Well, the consequence of that attitude, of that belief, is that we may give up trying to improve unpleasant feelings and emotions, right? Number 10, I must be very anxious, angry, or depressed over someone else's problems and disturbances if I care about that person, right? What's the consequence? Anxiety, depression, and anger. So we must watch our self-talk statements. Watch what we tell ourselves about situations. Watch what we tell ourselves about us, what we tell ourselves about others, and in particularly what we tell ourselves about our crisis situation, right? We have to be careful about that. Now, how do we challenge these distortions? And this is, I could do a whole lecture and presentation on that, but I've just got a few questions here that may be helpful in asking ourselves when we've identified that one of these, or at least how to identify that one of these distortions may be present. How do I know this? How do I know if this thought is accurate? What evidence or what facts do I have to support this thought or belief? How can I test my assumptions or beliefs to find out if they are accurate? Do I have a trusted friend whom I can check out these thoughts with? This is probably my favorite one. Is thinking this way helpful? Is it useful? And I've gotten to the point that even if my thought process is accurate factually, does it help me? And if it doesn't help me, then I don't want to waste my time on it, right? Am I blaming myself unnecessarily? Is it really in my control? Am I overgeneralizing? Can I look for shades of gray? Am I holding myself to an unreasonable or double standard? And then finally, am I making this personal when it isn't? Right? So I just read a few, but these are ways that we are able to really challenge ourselves and look at our thinking, right? Here's the thing. No one is born with right thinking. Right thinking is cultivated, right? It's something that we have to work on. We don't naturally think right. Our thinking naturally goes left, okay? So think about that. This is something that we must cultivate in this regard. We've talked about medication and counseling. There are a lot of medications that are selective serotonin reuptake, and these are medications for depression specifically that are just meant to boost serotonin levels in the brain, right? They can be helpful if that is called for. And then there are others as well, serotonin, norepinephrine reuptake inhibitors. These increase serotonin and norepinephrine to the brain. And then there are some other ones. These are older here, the tricyclic antidepressants. So just a little bit about medications. And actually, that is it. There are some helpful resources here that I think 988 should be posted everywhere. I do. I think it should be in churches, communities. I think it should be in grocery stores. I think it should be posted everywhere. It is suicide prevention hotline. It's 24/7 because you never know, right? You never know. We are oftentimes used to saying, I'm fine, or we may not have connection or people that we feel like we can talk to or be honest with, right? So 988 is a very helpful resource. The National Alliance on Mental Illness is great. It is a great resource. They have groups, support groups for family members, right? So their website is there. It's great. And then I would say whatever alcohol and drug addiction and mental health services is in your county and in your state. This here is from Ohio, so you wouldn't have this, but here in Michigan, you probably have one for sure. And then there are just tons and tons of support groups out there, tons and tons of educational opportunities. I would say the best thing you could do as a friend or as a family member is educate yourself. Know the language, right? Educate yourself, and know the correct way to be able to approach someone to see if they need help in that regard. So, okay, and that's it. Are there any questions so far about what's been shared? Yes.
How are you dealing with the whole CBD solves everybody's problems thing?
Ah, yes. Well, that's interesting that you asked that because, well, I'm from Ohio, and in Ohio they just passed that it's good for recreational use. So here's the thing, right? And I was kind of facetious in doing this, but I did it anyway. I just wanted to see what people had to say. So I would ask counselors, addiction counselors, like, hey, if you had some pain issues, chronic pain issues, and you were given the option, would you rather take opiates, or would you take CBD or marijuana? I just want to see what they would say, and I don't think they expected me to ask them that question. But the reality is that many of them said, hey, I don't want anything to do with opiates. I'll take the marijuana, instead. So here's what I think about that. I think, for medicinal purposes, there are some things, but alcohol is legal too. But we still have people in treatment, and we still have people whose behavior is irresponsible. So I think that if you're in the category where you have an addicted brain, it doesn't matter if it's legal or not, right? There are going to be consequences, as a result of using it. And perhaps marijuana used medicinally and responsibly, perhaps, it is an alternative. Perhaps there are some things that it's good for. I just know in my sort of context and in my world, I work mostly with people with addiction and mental health. It's an issue. It's not something that can be done without risk. So that's what I would say about that. And also, hey, studies are still going on as well. So we want to keep up with the science to see what the science is saying. I also think that, and I when I'm talking to clients, I always tell them, who do you think's making the money here? Who do you think's making the money here? In this regard, it's not me, it's not you. So, we got to really think about what we're doing in that type of situation. So, yeah. So that's my response to that. I know it's kind of generic, but I think there's more to kind of be discovered there. So, and there is some research that comes out of Colorado, because they've kind of been doing it for a while. There's some research there, but I'm not up on the latest research. So what I would be spotting is older research, and I don't want to do that. So, yeah. Okay. Anybody else? Any other questions? All right. If not.
Yeah. What happens, like, if somebody doesn't have a frontal lobe, like if a lobotomy was done, or?
Yeah. Well, that's pretty major. So it's interesting. Back in the day, a long time ago, prior to 1930s, for individuals who suffer from alcoholism, that's what they did. They performed frontal lobotomies. Can you believe that? Because they didn't know how to treat alcoholism at that time. Frontal lobotomies. That's major, right? Change your personality, changes everything. So that is, so we got to be careful, because we've been talking about here that we're dealing with something that's a brain disease. And so we have to treat the brain. right? This is the executive power of the brain here, right? Now, I also mentioned to you that I did work in a psychiatric hospital. And at that time, they performed, and I think I heard somebody say they're social work or something like that, they would perform ECT, electroconvulsive treatments there, taped to the brain. And I witnessed that and I saw that. And that was at that time, now we're talking over 20 years ago, right? At that time, that was for extreme cases, for individuals that they felt that medications had not been effective for them. So now, they would come in, I think maybe 2 or 3 times a year, to get those types of treatments, and it was supposed to stimulate brain function and activity. So I don't know, I try not to, nothing's black or white, so I try not to make a hard stance because I think I'm really big on individualized care. I do think, though, that it's really important that we care and treat our frontal lobes, with sensitivity and making sure that we are doing everything that we can so that this part of our brain is as active and as alive as possible. So I will say that. But I know that frontal lobotomies did not work for alcoholism. That's for sure. But it was, man, when you see the videos of that, it's really a shame that they did that. So.
But didn't people do that to their kids sometimes, have like,
I don't know. I'm not familiar with that. I'm not saying it didn't happen. I'm not familiar with that. So, yeah. Yes?
You had a slide that said fighting carbs with carbs, but you skipped over it. What was
Yeah, because so that was the complex carbohydrates that I had already spoken about.
Okay.
Yeah. So beans, legumes, nuts, seeds, whole grains, fruits and vegetables.
Okay.
Yeah, all of those are complex carbohydrates. And of course, simple carbohydrates are, your sugars and stuff like that. It's really not going to do anything but put weight on us and make us sluggish and that kind of thing. Yep. So those complex carbohydrates are really important there. So that's what I mean. The right type of carbs. Yeah. Okay, that's it. Well, listen. Thank you guys. I really appreciate those of you. I appreciate you being here, all of you. And again, those of you who weren't able to get them all, there's information there online that you can take a look at and let me know what you think there. Yes.
The previous presentations on YouTube.
Okay, previous presentations on YouTube. So feel free to look those up, and hopefully the information is helpful to you or someone that you're around or someone that you know. So I think we all have responsibility to be advocates of mental health because it's important for all of us. So, all right. So in closing, I'd just like to offer a brief word of prayer. Is that all right? All right. Dear Heavenly Father, thank you for the opportunity to share, to learn about how we can better care for our bodies so that we can be better vessels and instruments for you. We are fearfully and wonderfully made, and you died for all of us, letting us know how valuable we all are, sometimes no matter what our own brain tries to tell us. Help us to accept that truth, that we are loved, we are created for your glory. We are created for you to love on us and for us to be in a vital, living relationship with you. And so that's my prayer. I pray that this information is helpful, that it will help someone and may save someone's life. That's my prayer. Be with us all as we dismiss and go home. Help us to drive safely. In your name, amen.
Amen. Thank you.
Welcome.
Okay.